Perfect. All right, everyone. Welcome to our, is it Wednesday? Wednesday night webinar. Tonight we're talking about peptides and perimenopause. It's going to be so exciting. Dr. Paige and I are excited to bring this content to you. We recently did a webinar on microdosing GLP-1, and we decided let's expand this a little bit. Let's have this conversation specific to perimenopause because a lot of the women that we work with are in perimenopause, whether they know it yet or not. They are in that sort of decade before menopause where things can get a little wonky or where their body can get a little confusing. Maybe that's you, or maybe you're just like looking out in case that happens. Or maybe you're just curious about what these peptides are. There's a lot of talk right now about whether it's GLP-1s and the words Ozempic and Mounjaro and I don't know, there's all kinds of new things out now, right? And even for me, I'm digging deeper into other peptides as well for inflammation and other things. So I just think that this conversation is so nuanced. There's a lot of stuff out there. I feel like everybody is like throwing the word protein on everything now, and they're throwing the word peptides on everything now too. I was in Target yesterday and now there's protein Cheerios. And so I was like, is this a thing? Like, what's in this? And so I just wanted to see what it was. And I think they're adding like whey protein or pea protein to Cheerios now so that they can call it protein Cheerios. And there's only 4 grams of protein in that serving. So false marketing is everywhere. Same thing goes for the peptide world as well. And so I know even my mom, who's 78, has been asking me questions like, what are these GLP-1s? And I'm hearing good things and bad things. And I'm like, yeah, that's the world we're in right now. So by having Dr. Paige here, we're going to dispel some of those myths. We're going to give you the real information. This is the information that, I think people need to have before they make those decisions. I think there's a lot of conversation around weight loss and peptides, but there's also benefit to peptides for a lot of other things as well. So before I get into that, I'll just share with you, my name is Jenny Swisher. I'm a certified personal trainer, nutritionist, and I also have digital courses. I have a podcast. Like I really just crave helping women in the sphere of hormone health, which is how Dr. Paige and I crossed paths. I actually originally had her on my podcast. I don't know how long that, maybe 4 or 5 years ago. And I remember when we first met, I was like, I put a star next to her name in my notebook, and I was like, this is somebody I want to connect with again because here's the thing, only 3% of practitioners are informed when it comes to menopause or perimenopause. That's a true statistic. But yet we have millions of women going through this decade of life. And what's happening is there's a mismatch. There's women going into their doctor's offices saying, hey, like I don't feel myself, right? Or my energy is low, or my check engine light's flashing, and I don't know where to turn. And a lot of times they're met with a practitioner who maybe it's just not their thing that they're, specializing in. And so they just meet them with maybe an antidepressant or a birth control prescription. And I'm not here to say that that's wrong, but sometimes it's given before any investigative work is done, right? Or before we even peel back the onion to see why their energy is off, right? Or what fundamentals of their lifestyle could we be addressing? So I love the fact that Dr. Page's practice is the way that it is. I love that it's a membership-based practice. I love that she gets to spend extra time with the women that she's working with. So to be honest, when I had my community of women and just with people that listen to my show and everything else, when I had people asking me, what doctor do I go to? I was previously giving them an outline of here's what to look for and here's what to ask. And finally, when I met Dr. Paige, I was like, or I could just say, here, here's someone. And the fact that she offers telehealth is perfect. It's perfect because people can meet with her anywhere. So started setting up the women in my community with consults, but it wasn't just that easy. It wasn't as easy as saying, here's the doctor. I decided I wanted to sit on those consults with my community, with their permission, for the first 140 consults. So the first 140 consults that we did for my community, I sat in on those because I wanted to make sure that I was setting people up with the right practitioner, that they were asking the right questions, but also that the nuances of things like bioidentical hormone replacement therapy and pellets versus creams and GLP-1s. Like I wanted to make sure that everything I was learning was driving with the things that Dr. Paige was practicing and preaching. So we make a good team, I think. I think we make a good system here, and it's awesome that for me, this world of peptides is something that I'm just learning about. So as a migraine sufferer, as someone who went through infertility, endometriosis, PCOS, this is all so intriguing. Even my regular local primary care doctor that I work with here is like, Jenny, you've got to dig into this more because as a PCOS woman in your 40s, like this can be game changing for you as well. So this is a journey that I'm on too, just learning more about it, wanting to share more about it. And Dr. Paige is my number one resource for that. So if you're tuning in for the first time, if you're listening to this recording and you're like, what is this even for me? I would encourage you to think outside the box and really think about how you can dig deeper on your bio individuality. How can you find a practitioner, whether it's Dr. Paige or otherwise, who can really work with you on your unique self, because what might work for one person may not work for the other. I know we're going to get into the details of it, but I have friends that are like, semaglutide wasn't for me, but tirzepatide was for me, or vice versa, right? So everything's going to be different depending on your own self and your own physiology. So not only that, but you're your own best advocate. Normal is not optimal, and you deserve to live with maximum energy, right? And that's exactly why we're here. So without further ado, I'll let Dr. Paige introduce herself. She's going to kind of give us the rundown of what we should be looking for in peptides and perimenopause, and how could this really be serving us. But I just want you to go into this conversation knowing that it's different for you, right? And so what are the things that you need to know? What can you take away? What questions would you be able to ask? Take some notes if you can, or come back to this recording later and do that. Because we're here for you along the way. So at the very end, we'll share, if you're interested in options with working with Dr. Paige or else or otherwise, or education, we'll give you some options for that at the end. But Dr. Paige, welcome. I'm so
Thank
excited
you.
for you to dig into this. I think this is such a needed topic. I think people need the true education on what peptides really are. So I'm excited to kind of dispel the myths and dig in.
Yes, thank you. I am always pumped up for the late night Jenny Swisher webinar. So I'm Dr. Paige Gutheil. I have a practice called GOSA Wellness, which technically means enjoy wellness, which I think we are all here to do. And I am an osteopathic family medicine physician by training, practiced in a traditional primary care practice that I later converted to a membership model. And then, after training for years in lifestyle medicine, functional medicine, decided to combine all of that training in the service of perimenopausal and menopausal women. And so this conversation is the most fun conversation that I get to have. And so let's talk about good old perimenopause and peptides. One of the reasons that I love having this conversation is that I believe that we need to change the narrative, right? There's so much conversation around perimenopause that feels like, oh my God, what am I going to do? Things are out of control. It's all downhill. I'm just going to feel older and older. And I just feel so strongly that there is such magic to the perimenopausal time from a mindset perspective, from a social perspective, from a hormonal perspective, and that we got a lot to say as women, and we are meant to age with the confidence and joy and energy that we deserve. So, before we get to the good old perimenopause time frame, I just wanted to ground us in kind of looking at what our physiology truly is over the years. And so we talk oftentimes about our main three sex hormones: progesterone, estrogen, testosterone. And if we start back in good old childhood, those hormones are just trucking along, right? They're quite calm, but they are active, and they're active all over our body. Sometimes we focus on our sex hormones as though they are geofenced to our pelvic region, and they are not. We have receptors in every system of our body. And so they're active from birth. And so childhood is smooth sailing, right? Some of us remember it as maybe the last time things felt like smooth sailing. And then we get to the good old puberty years. And if anyone remembers those years or is fortunate enough to have ladies in puberty that are close to them or in their home, like I do, we know that those times can be a little rocky. They are rocky when it comes to mood changes, body changes. But what I think is so interesting about the puberty transition is that those years, we have so much grace for them, right? When we are supporting those that we love in puberty, we're patient and we know that it's a time of development and a time of change. And so when there are brain changes and body changes and behavior changes, we just have tons of grace, right? Nobody feels shame about that. Nobody feels guilty about that. So I want you to kind of remember that, right? And then we go through the fertile years, the reproductive years, and even though those have their own special breed of chaos, for a lot of women, it feels like a very predictable rhythm. And it's interesting, even to me, that we refer to them as the reproductive years because it's not lost on me that our healthcare system is fairly obsessed with helping us get pregnant, helping us not get pregnant, or helping us get pregnant successfully, right? And thank goodness, we're so thankful for that. But again, our hormones are not just about fertility. So when it comes to after those reproductive years, a lot of us entering perimenopause and the chaos that can ensue. When we go to our traditional physicians, gynecologists, primary care, endocrinologists, whatever the case may be, we can feel like, gosh, am I really being heard? I oftentimes think of the fact that when I was in college, I worked for an OB-GYN. I was like front lines at the front desk, answering the phones, people were checking in. And when I tell you the like VIP fast lane urgent treatment that every obstetric patient got during that time, it was primo service, right? And again, thank goodness. But then it was kind of like, oh, to get an annual exam as a 50-year-old female, hey, we'll see you in 6 months. And then that exam was all about a breast exam and a pelvic exam. It really wasn't geared towards helping us understand how our hormones work from head to toe and what the implications of that hormonal change during perimenopause and menopause is like. So perimenopause, just to, the nuts and bolts of it, right? Can't, like Jenny mentioned, it represents the 7 to 10 years prior to your last menstrual period. And all of these definitions, quite honestly, are fairly arbitrary, but we use them to have some common terminology. That 7 to 10 years represents a time where our testosterone, progesterone, and estrogen all tend to go down, but they don't go down without a fight. And so I sometimes refer to this time, make the analogy of perimenopause as the dysfunctional perimenopause family. And so I want to kind of track you through that just to get a big picture of like, okay, what is literally going on in my body, right? And so during, from childhood up to perimenopause, mama brain, she's in charge, right? She's signaling to the ovaries very consistently. And, not to say that we, like I said, don't have, rough times during our cycling years, but we get to know those rhythms. So mama brain is cycling to the or is communicating with the ovaries. The ovaries know what to do when it comes to producing progesterone, testosterone, and estrogen. Once the ovaries decide that they're starting to get the itch, they're starting to get like ready to retire, it's almost like they have that teenage brain. And I don't want to like play into the narrative of the, problematic teenager. My teenager is lovely, but a teenager's role is to kind of do their own thing. And that's exactly what the ovaries start doing. Sometimes they produce hormones erratically. Sometimes we have highs, sometimes we have lows, but we definitely don't have that smooth cycle that our brain and ovaries and the rest of our body are accustomed to doing. And so the most important thing to realize about when that starts to happen is one, it's physiologically normal. It's a normal transition time. It's not, nothing's gone wrong in our body technically. It just so happens that our average life expectancy, is always kind of a mind bender to me. Our ovaries lifespan is on average 52 years. Well, that makes sense given the fact that even as of less than 150 years ago, the average lifespan of us was 48 years, right? So there was a time where we didn't outlive our ovaries thanks to modern advances in clean water and vaccinations and whatever. Our life expectancy has really skyrocketed, but our ovaries life expectancy is the same, right? So now we outlive our ovaries by decades and decades and decades. So when the ovaries start to decrease their production, the body and the brain interpret that as a physiologic stress. That is a stressful event. And one that makes total sense as to why a lot of perimenopausal symptoms are brain related. The brain is meant to pick up on that stress and do its thing to try to help us cope and help regulate, right? Well, there's always one child in the family that's the peacekeeper that wants to jump in and help out, that wants to, just like clean up everybody's mess, and in comes the adrenal glands, right? That is our stress, those are our stress glands. They're going to run in and help in times of stress, and that's exactly what happens during perimenopause. Now, both because of direct effects, because our hormones do have direct effects on things like thyroid, insulin, and glucose metabolism, gut health, immune system, and just based on kind of the whole body picture of resources, sometimes in perimenopause, we start having these, I call them kind of the forgotten middle children, like they start going offline. Like, oh boy, you know, I never had gut issues. Now I'm bloating all the time. What's up with these rashes or dry skin? I am gaining weight more in the belly. I used to be able to eat three steady meals, sustain my energy all day long. Now I'm having peaks and valleys in my energy level. And so that's kind of the big picture of truly what's going on in perimenopause. So it's no surprise that when you see a list of symptoms of perimenopause, it's overwhelming. Let's be honest. It's like, what is going on here, right? And I think the take home message is one, let's not get overwhelmed, but realize that our sex hormones, estrogen, progesterone, testosterone, are present in every system in our body. And depending on your specific personal physiology, that is based on your genetic tendencies, your what else you have going on, and a lot related to your physiologic and nervous system resilience. That's going to determine what symptoms tend to pop up. Some people, I just was doing a webinar the other day, and one of the questions came up. It was a gentleman actually, and he's like, I talk to a lot of people in my practice. He's an alternative health provider, and they tell me all the time, oh, I didn't go through perimenopause. So it's like, what makes some people experience all of these symptoms and some people seemingly have, no symptoms at all? Well, one, I would argue that when women, generations ahead of us say, hey, I didn't have perimenopause, I would say, hey, let's talk, right? Because, oh, yes, they did. And oh, yes, chances are they noted they were put on an antidepressant. They were put on an antihypertensive. They noticed the weight gain. They noticed all these things, but the healthcare system called it 10 different things rather than this collection of symptoms with the root cause of perimenopausal hormone changes. But also, it's true that every woman's experience is going to be different. And so one of the lessons of perimenopause is to get out of that comparison trap, right? And say like, oh, what's going on with you? Is that going on with me? Yes, I firmly believe that women are meant to heal in circles, honestly. Like we are meant to do life together and be in community, but yet we're not meant to live in comparison. And so part of why I feel so passionate about the education that Jenny does and that I do is, hey, we need to gain some confidence in how our body works so that I can use my own wisdom and my own body knowledge to decide my next best step. And that's super relevant to peptides because the FOMO can be real. The comparison about like, well, this person's doing this and maybe I should do this stack is so real. Okay, so when we think about all those symptoms that can be in every system of the body, um, um, let's talk about, night sweats, hot flashes, irregular periods, changes in mood, vaginal dryness, changes in libido, more frequent UTIs, changes in hair, skin, nails, joint pain, stiffness, changes in headache patterns or new headaches, heart palpitations, trouble sleeping in the middle of the night or trouble falling asleep. Changes in mood can range the board. Um, the symptoms that we experience is one side of perimenopause, but I also want to call to your attention just the importance of what's going on physiologically underneath the scenes. Because even if you are one of those maybe so lucky women, right, that's like, hey, I'm doing great, it's important to know that every system of your body is stressed underneath the scenes, is having to go through an adaptation change. And so I often talk about when I'm thinking about my patients, I'm kind of driving in two lanes at once. I'm thinking about symptoms, but I'm also thinking in terms of prevention. Because if left unattended, perimenopausal hormone changes and menopausal hormone changes does do cause physiologic changes that increase risk of diabetes, cardiovascular disease, osteoporosis, Alzheimer's. The data is ongoing, but there is a connection there for sure. Oral health, I mean, the list goes on and on. And so not to say that everybody has to deal with perimenopause via replacing hormones, but it's important to address those physiologic changes that are happening, even if you're not having symptoms. So, you know, given the fact that, we have this long list of symptoms, plus we're thinking about, the physiologic changes, it's no surprise that we can feel like, oh my gosh, I'm feeling so great. I'm rocking my 20s, rocking my 30s, and oh my gosh, what happened in my late 30s and 40s, right? And so I think sometimes we're tempted to think like, oh my gosh, is like perimenopause having this moment? Is this a trend? Is this, just is this hype? Is this being blown out of proportion? And I want to humbly submit to you that hell no. This is not a trend. This is not hype. This is really a reckoning of society and the healthcare system and scientific research that has ignored the data on women's health, inching along to some sort of a tipping point, and it's not in my mind, it's like, gosh, if you think this is a trend or if you think this is, big news in medicine, we don't have nearly enough research that women deserve even yet. And so when we think about that, I just want to, emphasize like all the hype around perimenopause is much deserved. It needs attention. Doesn't mean we need to freak out, but we need to have a plan, right? If we want to age with joy, confidence, energy, and strength, and not in a nursing home, we're going to have a plan. Before we get started on delving into peptides and kind of where they fit, I just wanted to mention that even though we're focusing on peptides today and kind of their role in perimenopause, it is important to know that it's not like a either or thing when it comes to menopausal hormone therapy and peptides. Sometimes I get the question like, hey, should I consider estrogen cream or a GLP-1? And it's like, we're going to do both of those, right? Because they're totally two separate goals. And so a lot of our peptides really are kind of cherries on top of our physiology to help heal physiology related to metabolism, sometimes immune function, appetite regulation, muscle preservation, but they don't replace the fact that perimenopause and menopause represents hormone deficiency state. And the only thing that truly connects a hormone or corrects a hormone deficiency state is replacing those hormones. And there's no doubt that we know that when we use peptides together with hormone replacement therapy or menopausal hormone therapy, we do better. So just some quick notes, like what even is a peptide, right? Just like Jenny said, proteins everywhere, truly peptides are everywhere. And it almost makes me giggle because it's like, oh, it seems like we need to have better language around this because from a medical perspective, the term peptide is so generic. It truly, a peptide simply means a short chain of amino acids it's as generic a term as protein. There's tons of different types of proteins. They have tons of different actions. Or some people would consider them mini hormones, which I relate to a lot. There's an infinite combinations of them, both naturally occurring and that our body produces. They are simply cell structure or structures that truly act like hormones and that they are messengers helping cells communicate and they regulate processes like metabolism, inflammation, and healing. But truly, the term is a little generic because the actions that they cause are almost infinite. And so, why are peptides everywhere right now? I do think the bigger peptide conversation was very much spurred on by GLP-1 conversation. GLP-1s are one type of peptide. They were first studied in relation to diabetes. I've been prescribing them for over 2 decades. So very familiar with that use in diabetes. And then, of course, as our experience with them has progressed, as research has progressed, as our respect for the kind of spectrum of I hate to say dysfunction that eventually ends in diabetes increases. So the healthcare system, as you know, is very good at defining kind of like this end range thing called diabetes. But it's not like our physiology is completely optimal and then one day we could become diabetic, right? Things change along a spectrum. And so as we define that spectrum and start picking up those missed signals earlier and earlier, we start noticing, oh gosh, GLP-1s are so helpful for those that have obesity and other cases. And so other peptides really have been used more in the alternative medicine world for quite a while too. The only difference is most of them by far really don't have that rigorous scientific study that we look for in the FDA approved peptides. They have a lot of anecdotal evidence and we know a lot physiologically about how they work. But when we're looking for kind of that safety reassurance. A lot of the other peptides don't have that. And so I just want to take a moment and say, kind of as we dive into the peptide conversation a little deeper, is to just kind of think about like where all this noise fits in for you, right? I think culturally there's so much going on. We have thankfully more and more emphasis on prevention and longevity, but it's very easy to like take that to the extreme and feel like we have to be doing all the things. And so the longevity conversation has gotten very complicated. Of course, a lot of these peptides are related to body composition, and we all know how complicated that conversation is as a female in our culture. And so the connection between how we feel about our bodies, what we feel our ideal body composition should be, is just so complicated. We have a lot of people that, see using peptides as cheating, and that really doesn't do service to what we know about the condition of obesity these days. We know that obesity is just like every other chronic condition, a biopsychosocial phenomenon, meaning there's intense biologic drivers to obesity. It's a brain issue, it's a hormone issue that determines how your body will store fat versus expend it. The psycho part, right? Our relationship with fueling and with our bodies is very much has mental component to it, right? And then a social issue. Feeding ourselves and body image, very much a social issue. So there's a lot of judgment in this space that I hope that we all can kind of put aside there. So on one side, we have this concept of like, oh, I need to do it myself. I just need to, kind of be all natural and get through perimenopause and menopause naturally, or get through a body composition journey naturally. And then on the other side, we have this sometimes overzealous FOMO culture of, oh my gosh, I need to be doing all the things, right? And we all know all the things, and a different thing pops up every day. Do I need to be doing a vibration plate? Do I need to be doing red light? What supplements do I need to be taking? I have this very creative peptide stack. Like, do I need to be doing that? And so this is very much not like pro peptide conversation. It's not everybody needs to be doing peptides like you might hear down at the gym. And it's also not a scare talk, right? Like there are some concerning things that could happen as a result of peptide signaling in certain situations. But it's my hope that we can have a discussion that really helps you kind of center what you're doing for your health, what your goals are. And one thing that I feel really especially passionate about is there's so many ways to approach our health. It really has to be centered in your confidence and your healthcare philosophy, right? Like I talk to tons of women and they're like, hey, I want to keep it natural, right? But yet also, if there's benefit to using a safe, scientific thing, great. And then some people that are like, hey, I want uh, health by biotech company. I want to know all the hacking and do all the things. And it's like, okay, let's have a conversation about the pros and the cons of all of that. Okay. Um, I do think that it's important to realize, and this goes back to what I mentioned a little bit earlier, women in midlife are unique, right? Like, no matter what we do, no matter how natural we want to be, if we had the best nervous system regulation, if we had the best sleep, if we had all the money in the world, not a care in the world, if we had the all organic, perfect macro diet and all the balance of fitness and recovery, perimenopause is still going to be a physiologically stressful time for you. And in my opinion, still deserves support. And to me, that baseline level support is a really specific conversation, first of all, about your physiology that and your lifestyle, about what's going on, and some information about that we get through blood work and testing. We won't have time to go through all the testing, but responsible level of testing. Um, that's what everyone woman deserves over the age of 35, so that then we know, okay, what's my best next step in support going forward? And that support is going to change. So, I really hope that everyone really kind of says, okay, we're, ditching the like eat less, exercise more, grind ourselves into health. We're going to support our body during this transition. We know that foundational self-care is always where it starts. And this is where Jenny and I are just so aligned. There are very specific foundations of nutrition and fitness and nervous system regulation that we can do for ourselves to create that foundation. And how effective peptides are for you is absolutely dependent on that foundation. With a little bit of a disclaimer, I never want women to feel like, oh, I better get it together and then I'll see if I need peptides, right? Because we're never going to be perfect. We're never going to be perfect at all of that stuff. So, absolutely, two things can be true. You can do the work to care for ourselves and learn about our bodies and keep improving with grace, and you can accept support for your physiology. So, if there's one thing about me, you can call me like, I don't know, two Susie Sunshine. You can't tell me that I cannot create a win-win for someone who works with me. Like, we are going to create a win-win. Okay, so let's start with GLP-1s. They are, I'll just give away the punchline. Like, they are the superstar of the peptide class. Not only because they have decades of study behind them, and they have versions that are FDA approved and well regulated and controlled for quality, but also they just get a lot of stuff done. Like there is really not another class of medications that can get to the root of a lot of physiologic dysfunction like a GLP-1 can. And so GLP-1s stand for glucagon like peptide 1. Technically, it's naturally occurring. Our body can create it, but the type that our body creates gets created and washed away really quickly. And so there is a synthetic version that is bioidentical to the version that your body creates with a tweak that keeps it from being degraded as quickly. And so that's where all the names come in. Semaglutide, Ozempic, Wegovy, tirzepatide, Mounjaro, Zepbound are all GLP-1s. Now, with the little caveat, technically, tirzepatide, Mounjaro, Zepbound, which are all the same molecule, are something called a GLP-1 GIP. So just two similar signals in one deliverable. You can get these compounds from your local pharmacy. You can get them direct from the company, or you can get them from compounding pharmacies. And so that's why you see them so readily available. Telehealth companies, some your local doctor can prescribe them. The difference, there's a couple differences in how you get them, right? If you're going to get them through your insurance, through a brand name FDA approved, unless you're going to pay out of pocket for them, you need to have an FDA approved indication for them. And we'll talk more about that. And so, because we know they're beneficial in a lot of other scenarios beyond obesity, beyond um, diabetes, compounding pharmacies have stepped in to increase the supply. Um, One note about what GLP-1s are not is a lot of the marketing terms that you're hearing, oral fiber. You'll hear like supplement companies talk about bitters, plant extracts, amino acid blends, like these proprietary peptide blends, like those all are terms that really kind of, I think, take advantage of the generic definition of a peptide. And, but at the end of the day, they are kind of weaker versions of naturally occurring agents that can stimulate your natural GLP-1 or stimulate some other peptide effect, but are never going to be like as strong, for lack of a better term, as even the most microdose of GLP-1. And so GLP-1s do tons of things. You'll hear people say like, "Oh, it just knocks out your appetite," or "Oh, that's just to regulate your glucose." They really do a lot in the body. They are gut brain signalers, and there's a lot of hormonal and neurotransmitter action in that gut brain axis. The benefits that we get from them physiologically mainly come from their ability to regulate appetite and satiety. Um, of course, you've probably heard of the term food noise. And I can't say that if you ask me what food noise is, it's like, I don't really know how to explain it, but everybody knows what food noise is. Um, Most people, I probably should say, have experienced more of a psychological pull to food or a lack of satiety that feels uncomfortable for them. Um, and that's problematic for so many people. Improved insulin sensitivity. That insulin, again, we kind of talk a lot about, hey, diabetes, and we think about our blood sugar and insulin in terms of if we have diabetes, but everything we eat gets broken down into blood sugar molecules. You have to match that blood sugar molecule with insulin to get energy inside the cell. So really, we should be talking about glucose and insulin as energy, right? That's how we regulate our energy. And so we know, for example, that when we keep glucose levels steady, we have steadier energy. When we keep insulin levels steady, even though insulin, for all the good that it does, it is very much a growth factor. It is very much a storage signal. And if we're not trying to store extra energy in the form of fat, we want to keep our insulin and glucose levels steady. Um, GLP-1s kind of slow down the gastrointestinal system a little bit, so you do feel fuller faster. There's downstream effects related to lowering inflammation. The downstream effects, you hear something new every day, it seems, about how there's a cardiovascular benefit, decreased fatty liver, increased can brain energy, decrease risk of Alzheimer's, decrease risk of kidney issues, and all of those studies are real, right? They're coming out even faster than we can count, it seems. One thing I want to circle back again to the natural GLP-1. I never want to downplay what we can do with food, right? And it is true that we can get a lot of benefit by eating in a way that takes advantage of our natural GLP-1. And honestly, that's the mainstay of our nutrition advice of focusing on protein, fiber, healthy fats, and decreasing refined carbohydrates in general. That is what helps our body produce the most GLP-1 and gives you the most satiety. And so, of course, that's wonderful, and everyone should have a foundation of healthy lifestyle. But I also don't want to play into the fact of like, oh, you shouldn't need a GLP-1 if you do these things. The reality is that many people's physiology, even eating in the best way that they possibly can, will not never get the same benefit in healing powers of a GLP-1. So how are people using them? I mentioned diabetes, weight management, even in the setting outside of those settings, decreasing cardiovascular risk, sleep apnea, fatty liver, kidney protections, all of those are kind of FDA approved indications. And then there are a whole host of what we call off-label uses. And off-label uses are simply uses that maybe for whatever reason, the pharmaceutical company hasn't filed with the FDA, done studies specifically related to some indications. paid the money, whatever the reason is. The FDA hasn't approved these uses, but that doesn't mean that the clinical experience, what I see in my practice, as well as the scientific evidence isn't there. And so some of the off-label uses do involve kind of that perimenopausal transition because you will have an increase in insulin resistance during that time. You will have an increase in visceral fat during that time. And then there's some other indications that are commonly used: PCOS, endometriosis, autoimmune conditions, either those at risk for autoimmune conditions or currently having them. And then there are some people that honestly may have the best physiology that we possibly can tell, but use GLP-1 peptides for their prevention and longevity benefits. Um, Dosing, I just want to mention that it's very personalized. Some people respond to lower doses, some people respond to higher doses, and that doesn't mean that you have a worse or better physiology. The term microdosing is thrown around left and right. I think that very much should be called personalized dosing because I just see dose response being very variable. So I never want people to feel that, hey, if you need a higher dose, that means you're worse than someone who needs a lower dose. Um, One of the benefits of using a compounding pharmacy is that you can personalize the dose. That's also available when you buy a brand name GLP-1 direct from the company now. They come in vials and not necessarily the pre-made pens. When we were only using the pre-made pens, in my opinion, that dosing is very aggressive. It starts at a higher dose than most people need. It requires you to increase the dose every month, and that's just not, reasonable or necessary for most people. There are some side effects with these medications sometimes. Most of the time, they are not necessarily related to the medication, but related to the adaptation and the change in nutrition and hydration that happens. And so things like nausea, constipation, feeling an appetite that's too suppressed, having reflux, to me, those are again, call me Susie Sunshine. We can design a win-win when it comes to that. Those really are related to dose and related to being patient with going slow, starting low and going slow and finding the dose that's right for you, and adjusting your nutrition around it. I sometimes tell patients that the side effects that you hear about on the news and that are so scary don't scare me at all because I know that in what populations those were present in and that they're so, so rare. And those are things like, pancreatitis and gallbladder disease or thyroid tumors, even the vision changes. Like, I have a sense of confidence in that we will not encounter those. The side effects that worry me the most normally come from the temptation to undereat and lose weight too quickly. And so the side effects that I worry about are the muscle loss and the loss of elasticity in skin and the loss of vitality that can happen if you're using too high of dose. As well as we have to, of course, be aware that our relationship with our bodies are very complex. And sometimes, whether you have a history of disordered eating or not, quite frankly, I've had patients that have used a GLP-1 that have had pretty severe eating disorders, and they absolutely do great because a GLP-1 is a treatment for that in that it decreases the food noise and obsession that they have experienced. Also, patients that have a history of disordered eating can be at risk for triggering that, can trigger obsessive restriction or the desire to lose weight in an unhealthy way. So I really feel like when you're working with a GLP-1, you really, one, have to have that self-awareness and have to walk alongside a physician that is not just treating your body, but treating your mind as well. Okay, I had to put this in here because I think sometimes in all the peptide conversations, we forget about good old collagen. Collagen is a peptide. And I think the cool thing about realizing that is kind of makes you realize, like, oh, I can think about these peptides as like these fancy things or GLP-1s as like these fancy things. But collagen, I just don't even think about it at all. Like, I'll ingest that, left and right. And so, a peptide is a peptide, and there's a wide variety of them. But when I think about the peptides that are, kind of have the green light and the safety category for by far the majority of people, of course, we probably should give the responsible disclaimer at the beginning that this is not medical advice, this is education, and you want to personalize what you do according to a discussion with a responsible physician. But collagen peptides, generally safe. We turn for them for support with bone health, skin elasticity, tendon joint support. They do have pretty good, cool studies in the background. The only problem, honestly, or the biggest problem, I think, like a lot of things that we talk about, is sourcing, right? You have to be responsible and knowing what you're getting and using the appropriate amount, making sure that it's bioavailable and tested for purity. But when it comes to a lot of the concerns that good old perimenopausal women have, collagen peptide is a good thing to turn to. I mentioned this copper peptide, GHK Q, not because it's the most like it's the fanciest or the most common, but it is one of the safest in topical form. So it can be used in injectable forms, which there's less data on, but in topical forms, it can be helpful for skin and hair, specifically collagen production, as well as hair regrowth and thinning hair in males and females as we age, but especially in the perimenopause years can be a concern. So that this is a really effective one and safe one when it's used topically. Next one, good old BPC 157. It is used for injury recovery, gut support, pain and inflammation, but it's mostly known in those kind of two categories of the musculoskeletal world and gut health. On the one hand, it doesn't have a ton of human data. There's like one study that I'm aware of to date. It does have a lot of anecdotal evidence, and it really, to me, brings up the main point when it comes to why would I consider using a peptide, which is what is your goal and what have you already tried, quite honestly. So, we do have some data related to BPC 157. It is limited, but we also know that it has some underlying physiologic mechanisms that can be of concern in some people, at least theoretically. And we have to think about those theoretical concerns if we don't have the nuts and bolts safety data, right? And so one of the ways that BPC 157 works is that it's a growth factor. It allows your body um, to signal tissue growth and signal the development of new blood vessels. Well, the main concern that you hear about with BPC 157 is if you already have an underlying cancer, then how do we know that it's not going to signal growth in that too, right? And so I have a lot of experience using BPC 157, not as like a longevity, everybody needs to be on it forever. In fact, it's very good for episodic use. And so this is not something that everybody should be using. and it's not something that you should be on all the time, but in the right person, it can be helpful. Tesamorelin is another one that you'll hear quite a bit. Its specialty really is in metabolism, metabolic health, decreasing visceral fat. And interestingly, it has a decent amount of safety data. It is FDA approved for certain conditions related to people living with HIV. And so we have a pretty good idea of what to watch for. There are things to monitor related to glucose and metabolic status. Um, it is something that signals growth hormone, and like we'll talk about in a minute, that seems like it would be a good thing. But again, it's hard to have the reassurance when we're signaling growth hormone that we're growing the things we want to grow and we're not growing the things that we don't want to grow. So we need more study to have that safety for most of peptides, in my estimation. This one does happen to have a little more physiologic growth hormone secretion. Growth hormone is secreted by the pituitary in a very specific way. And so when people dose growth hormone or when people dose some of these sermorelin, ipamorelin, CJC 1295, oftentimes you're getting a really like non-physiologic both amount and pattern of growth hormone. So even just theoretically, it's like, okay, I don't have the safety data to know I'm growing what I want to grow and not growing what I don't want to grow. But also, I know that I'm really exceeding like physiology. So, in my mind, when I'm judging things that we don't have all the safety data that we would love to have on, what that easy for me to say. When we don't have the safety data that we would love to have, I have to think about, okay, what's going on with the patient in front of me? What else have we tried? And then what's the underlying physiology that could potentially go wrong? And so, some of these, for example, are a little farther towards that, we're not really mimicking physiology the way we'd want to more than tesmorelin. Nonetheless, they're super common. I'm sure you've heard them in the stack for a lot of people. They anecdotally have shown benefit related to sleep, recovery, maintenance of lean muscle mass, and decreasing fat. And so, like a lot of things, we want to have more data. We want to know that these aren't necessarily for um, like use our whole lives. Might we use them in someone who has specific goals to reach that where we've tried other things and we don't have red flags? Yes. These two are interesting. Semax and Selenk. And I have to say, I don't have a ton of experience with these two, but the data on them isn't so bad. They're both neurologic peptides. So we see their benefit in mood, brain fog, kind of brightness of, or brain energy, sometimes I call it, like being able to fire on all cylinders. And in theory, if we have healthy modulation of brain-derived neurotrophic factor, that could translate to help with ADD-like symptoms and even may have a relationship to risk of Alzheimer's. And so they have not a lot of study related to them, but some they do have some long-term safety data, which is nice. The real risks related to them are not unlike some of the antidepressants or other like neurologic or psychologic related medicines that we use. we could miss the mark, right? So if we could have some overstimulation or headache or agitation or unpredictable changes in mood. Solank in particular does have an immune effect, and immune modulators, like we'll talk about with a few of these, TB500, thymosin beta 4, and those type products, those work primarily by modulating the immune system. And we have a lot of immune modulators, quite honestly, that are FDA approved. And what we know, I'm giving you a little bit of insight in like my thought process of how I judge, like, okay, is this worth the risk or not? The immune system is so complex, y'all. We know through the study of a lot of products that have come to market for autoimmune issues, allergies, immune deficiencies, that there have been a lot of failed attempts, right? And a lot of like stimulating of a certain immune path that seems like it would be beneficial, but then you stimulate a side pathway that has negative consequences. And so it makes me a little more makes me a little more reserved, I guess, and recommending some of these products, knowing that, they're immune modulators that haven't necessarily had that safety study, because we know that system can just be so complex. Now, again, when we go to, you know, using things off label and when we see patients that, are suffering with autoimmune conditions or chronic inflammatory conditions, and we've tried a lot of other things, would I say that it's never worth trying one of these? No, but it's definitely not in like my standard perimenopausal wellness toolkit. It is really more advanced than that. So when I hear people say like, "Oh yeah, I'm on TB500 and XYZ and Timbuktu," like I get really suspicious that we're just kind of stacking things on because we're trying to be creative and we're not really getting the effect that we want to get. Because my goodness, if we see the effect of one peptide and, kind of we can have a little, like we have some knowledge about how it's going to work physiologically, that's a stretch even with some of these, right? Like having the confidence that we know what they're going to do. But then when you have these creative stacks, it's really just alphabet soup at that point when it comes to having confidence. So, all in all, like, where does all this fit, especially in the land of perimenopause? Whole health care is a must, right? Like, the foundation is what makes peptides work. They have to have a substrate, they have to have a foundation to work upon, and what allows them to be safe and effective. And so, supporting nervous system, mindset, biochemistry, body structure, lifestyle is always going to be just so important, starting with the foundation of lab testing. Some of you may have heard me say before, I consider myself fairly middle of the road when it comes to laboratory testing. I have what I call an expanded foundational stack, which actually is available direct to consumer for, I think it's less than $200, which is lovely nowadays that you can get an expanded stack of blood work without having to go to your doctor and explain to them, hey, I don't want to just check my CBC. Can I have a CBC plus a ferritin, please? It's like so frustrating, like Jenny mentioned, to have to navigate relationships sometimes with a physician that has their own rationale, nothing, against that rationale, but just isn't in alignment with your healthcare philosophy. So expanded foundational blood work is just so important. But I also recognize, having trained in the functional medicine model, There are a lot of situations where you might encounter a clinician that wants to order, thousands of dollars worth of testing that really is just not necessary until we know that the foundation is what it needs to be. And so, in addition to that, of course, I just wanted to hit the high points, the very thin, layer of lifestyle. We know that macronutrient support of protein, fiber, healthy fats, leaning into whole foods and less into processed foods is just so key. As much as I would love to be confident that we all could get enough of our micronutrients in a healthy diet, I believe every perimenopausal woman needs to supplement because one, you're not just living like quote unquote like normal life. You are living and supporting your body through a physiologically stressful state. And so it becomes even more important that you're optimizing things like iron, methylated B vitamins, magnesium. There's a few others in there, of course. We know that as we age, if we're not protecting our strength and mobility, they're going down. So that's where we should be putting our priority when it comes to fitness. Nervous system regulation can't be underestimated when we're going into this physiologically stressful time. If we have already dipped into our physiologic stress reserves, both neurologically and hormonally, it's a rougher time, right? Our culture does not encourage us to be in parasympathetic mode, which you may have heard as the rest and digest mode of healing. I call it the everything's okay mode because it's only when you truly embody the feeling of everything's okay that you can optimize your parasympathetic nervous system for healing. And spoiler alert, nothing in our culture, nothing on Instagram, nothing on the news, nothing that your teenager says to you is made to optimize your parasympathetic nervous system. Like we are fighting an uphill battle when it comes to that, but we can do it, right? And then of course, restorative sleep. Sleep makes the world go round. They don't call me the sleep, oh shoot, what do they call me? Perimenopause brain at its finest.
Sleep queen or sleep police? You've
I
been
was,
both.
I know. I was gonna, yeah, it is. Let's go with Sleep Queen.
I
This
like
is what
queen.
we're do that's what we're doing now because the word that popped in my head was like not good. Okay. Overall philosophy on peptides, especially GLP-1s, like I mentioned, GLP-1 really is kind of the queen of the peptides. My philosophy is that they truly are overutilized in ways that are not healthy, but also severely underutilized in ways that can be so beneficial and so healthy. They're a tool in the toolbox by all means. Not everybody has to use them. For some people, they're the cherry on top that can really optimize your health. But for some people, they really are kind of the glue that holds everything together that can really give them a leg up to improve their physiology. And so we don't want to, shy away from them, but we don't want to feel like, hey, are we missing out if we don't need them, so to speak? Foundation first, we can't overemphasize it enough. But remember, you don't have to earn your peptide. It's not like, oh, if I do all of these things and then I'm not feeling better, then I get to get a peptide. No, you deserve support even as you're working on your lifestyle. And peptides, I think, especially GLP-1s, their use really does deserve to be expanded. So when we're tempted to think like, hey, is this just hype or is everybody on peptides? Like it can be done responsibly, both from a physiologic and from a mindset perspective. I wanted to touch on just briefly what's the long-term outlook here, right? Like, am I on these things forever? How do I know when to go on, go off? And obviously that's a personal decision, but looking through the perimenopause lens, perimenopause is a period of 7 to 10 years that is physiologically stressful. And if we help our body navigate that physiologically stressful time, support it during that time, our physiology at the other end, we come out the other side, all the better, right? So some people certainly have conditions that maybe are more advanced, that they will use peptides to help control and optimize their health their entire life. Some people will use peptides during that physiologically stressful time, and then will settle into a new physiology that's healthier and won't need them. And then some people honestly will take them for the rest of their life as more in a preventive or more in an optimizing role, very akin to collagen peptides, creatine, and some of the other supplementation strategies. And so there's no right or wrong. It's just about, knowing your personal physiology, working with a trusted clinician that you can be in touch with and that embraces mindset, nervous system, biochemistry, structure, all the things, and isn't just uh, a peptide vending machine online. And how we navigate whatever amount of time you want to be on a peptide is very individual. Some of them are you use them for a season, you're doing great, you're off of it. BPC 157, for example, is a very good example of that. You might use it for an injury, you might use it for a gut flare-up or whatever. Um, some of them you may be on long term, but we're going to cycle them on and off because they work in such a way that we don't want to have that steady signal. Sometimes we're going to cycle them by adjusting the dose. So there's different ways to approach that depending on your goals. So peptides, you do you, right? So I always want women to make decisions based in their own confidence and their own support. So certainly there are some women that thrive without them, but also you deserve to have that support during a physiologically or emotionally stressful time. So there's no real good or bad path in my estimation, except the one that's chosen from fear or from confusion. We're not doing that. Um, if I had to pick one theme of perimenopause, or one message related to perimenopause, it's really instilling in each of you that you are not broken, you are not failing. Your body is adapting, and we need to work with her and not feel like we're fighting against her, right? As frustrating as sometimes it can be. And you truly deserve the tools and care that are rooted in your physiology, your goals, your healthcare philosophy. It's not a DIY. I know we're going to talk about these things with our girlfriends over a matcha and whatever, but it's not a like, hey, let's figure it out ourselves over a drink. It really deserves that full picture. So with that, do we have time for a couple questions? We're
Yeah, I mean, I know, I
chatting.
mean, for me, I like a late night party, like you said. So I don't operate until 8 a.m. So you'll never catch me on a webinar, early. Why do that? If you guys want to stick around, you can. I know we've already taken a lot of your time, so we understand if you have to hop off for sleep priority reasons, perhaps. But we'd love to answer questions if you have them. I just wanted to, while you're thinking of them, chime in and just say, this is exactly what I mean when I say we need the education for ourselves to really be able to advocate for ourselves. And when it takes both, right? And that's I feel like the message that I like to drill home with people is a lot of people will maybe they'll hear me keynote or they'll hear Dr. Page and they think that the answer is just in finding some sort of doctor that has the knowledge. And in reality, it's both. It's both you having the knowledge and understanding your unique body and physiology. And then that up levels the conversation with the right practitioner. And then you get somewhere with your energy, right? And you start to make progress. And so a lot of times, I know early on, probably 5, 6 years ago when I would talk to people, I felt like the takeaway for them was always, oh yeah, so I don't think I'm with the right practitioner, right? And that's a great realization. And that's a realization that women have every day in my inbox. But when you really dig in and you learn more about perimenopause, I love that, by the way, the dysfunctional family analogy is so amazing. But when you start to learn these things, even in simple terms through analogies and stories, and you're able to then up level that conversation with your practitioner. So a couple things I want to just call out, some of the things that I talk about when I'm teaching that really align here. I want you guys to understand 72% of women will deal with hormone imbalance, if not before perimenopause, then during. 82% of hormone imbalance tends to tie back to blood sugar as the root cause. And so I know for me, as a nutritionist, as somebody that's worked in the fitness space, more so with people, I used to look at food diaries every single day of women, and I would see the same things over and over, which was usually, dramatic undereating. And I know that sounds crazy because usually when I would say that to a woman, they'd be like, "What? Like I don't undereat." And I'm like, "No, you do undereat. Most women are undereating protein. They're under eating healthy fats, or they have mixed fats because they think fats are bad because of diet culture. They've maybe even been told by a practitioner. I had my OBGYN actually tell me more HIIT training, less, cut back on carbs and do more HIIT training, which couldn't be further from the truth in perimenopause sometimes, right? So we're getting all these different signals from what I call diet culture, especially as women, right? We're kind of being pitched this idea that we need to work harder and eat less. And it's just the opposite of what our physiology is demanding during this physiologically stressful time. So it makes sense to me, in my brain, as I listen to Dr. Paige, it's like, of course, peptides then are such a game changer for women in this time. Because if we look at blood sugar being sort of, I teach the legs of the chair, right? But if we look at the blood sugar leg of the chair as being really pivotal for your overall energy and sustained energy, you think most women aren't fueling enough. So they're riding a roller coaster of energy throughout the day and they're wondering why that's happening. Now you've got cortisol at play because now the adrenal glands are saying, hey, we're taking over this baton from those ovaries. We're going to help do the work now. Your body's in this state of stress. So your blood sugar is what's going to be something that's kind of the main player, right? So it makes sense to me that the GLP-1s, for example, because I know that's the big one that we talked about, it makes sense that that can be so beneficial during this time of life, right? To just kind of tie it together for you guys. Like I just think I've had tirzepatide in my refrigerator for months and I've been afraid to do it. Dr. Page is always like checking in with me about it. And I'm like, because I have lived in this world of like feeling like lifestyle was 100% all I needed to focus on. But I have
Yeah.
seen this firsthand from so many women in my community. They're doing the things that they should be doing, right? Like they are lifting weights, they are doing progressive overload style workouts, they're building muscle, they're hydrating every day, they're focusing on minerals in their hydration, they're focusing on their sleep, and they're feeling frustrated, maybe not even because of like weight loss resistance, but maybe just because of their energy, right? Or maybe just because of the moods that they're in on that roller coaster every day. And so, as Dr. Page has said, these GLP-1s or other peptides can really come in and help, especially during this transition. So I just wanted to say that because I think, if you come from my mindset where you're like, is this really like, I don't know, like, should I be doing this more so? Is this cheating, right? Like in your mind. But I think that's the wrong mentality. In fact, like I said at the beginning, as a migraine sufferer, I've been diving into the rabbit holes of peptides for migraines and um, everything that I'm seeing is just screaming benefit, whether it's for like Alzheimer's dementia risk, migraine headache, like different forms of inflammation. I've seen people talk about injury, right? And how BPC 157 can help with injury. And like as all these things that you've been mentioning, it's everywhere right now. Where we go wrong is when we try to cheat the peptides. And that's what I want to encourage you guys today. As we mentioned in the beginning, there's a lot of false marketing around this. I was in Costco today. The word peptide, proteins, and collagen are probably the most popular words on all branding right now. So be very careful and just understand that if it's an oral ingestion of something, hopefully you're working with a practitioner on this to understand that injectables usually preferred. There, as you mentioned, there's topical options. It doesn't mean some can't be taken orally, but just do the research on it is all I'm asking. Ask your practitioner, work with someone knowledgeable, like you said, not just a dispensary or vending machine for peptides, but somebody who really does commit to this type of work so that you're ensuring that you're doing this the right way for you. So hopefully I gave you enough time to ask any questions if you guys have them.
Yeah, I wanted to, I hit on this a little bit, but Tammy, your question about like what happens when you stop using them is such a good one. Um, Typically, you'll hear the narrative like, oh, once you're on them, if it's related to weight loss, oh, you're gaining the weight back and this and that. I don't subscribe to that, and that's not what I see in my practice. But it is different for everyone. Like, one, if you'll want to use them long term, or how we come off of them. So, if you take someone in like perimenopause, for example, who, because of hormone changes, etc., finds themselves up 15 pounds with an increase in visceral fat, and you use a GLP-1 as well as other ways to optimize your health during that physiologically stressful time, which was the cause of the weight gain, then when you gradually ease off of them, your body, it's almost like your body learns a new, healthier metabolism, right? And so I don't find that people regain the weight if they're titrated on and off properly. Now, you definitely will see, um, especially people who have dealt with lifelong obesity or, for a long period of time, it takes longer because the longer your body learns that dysfunctional metabolism, perhaps the longer it's going to be to retrain that metabolism. Tomorrow, my practice, we do a book club every so often. And tomorrow, our book club is the book Enough, which is the one that Oprah wrote with her endocrinologist around her weight journey and GLP-1s. And it's a great book if you've never read it, or you can come to the webinar. I'll send you guys the link. Um, it really is fascinating, the science related to how the body determines if it's going to store fat as fat or burn through it. And what I think is most fascinating is what do we think the ultimate goal is with our metabolism? It's metabolic flexibility, I think. Metabolic flexibility is what allows your body. It doesn't matter if I take in technically 3,000 calories or 1,500 calories in a short term. My metabolism will flex up or flex down to know, hey, I don't need to store this. I have enough storage. So when you think of it that way, like by definition, someone who has the tendency to store excess body weight has a neurologic and hormonal dysfunction. Because if their body was metabolically flexible, they would not overstore fat, right? And so I don't know why I'm off on this tangent. It fascinates me, that's why. But I think it's so helpful to eliminate the stigma that's been ingrained in all of us of calories in, calories out. You should have made better decisions, or you should have this, that, and the other. A healthy metabolism, not a healthy behavior, but a healthy metabolism, which is governed by your relationship with your brain, is what determines if you're going to have excess body weight or not, right? Because if it wouldn't matter what we're eating, like the body would be able to flex on and off if we had a healthy metabolism, also in responding to a healthy environment, right? Because the reality is we are also in an obesogenic environment, like the stress of it all, the toxins of it all, the ultra processed foods type thing. So it's not as like simple as that, but I think that mindset is so powerful and like again, like fighting against the stigma. But ultimately, like these peptides are training tools for your metabolism. And it's kind of like, well, the jury's out if we can train your metabolism ultimately to then fly on its own without them, that's wonderful. But even if we can't, it's like if you had your thyroid taken out or if you had, type 1 diabetes, like would we say like, oh, I'm not going to start the medicine if I might have to be on it forever? It's like, no, it's like we're going to live the healthiest life possible, accepting the support that we need. So, oh, let me step down now off my soapbox.
I have a question for you that's I don't know if I was going to save it, but I think I'll share it. So one of the questions that I've been getting asked recently, especially from like fellow PCOS women that just friends of mine that are either using GLP-1s or they started GLP-1s or thought about it, is this question of do you ever use a GLP-1 like tirzepatide or whatnot alongside something like metformin? I have one friend in particular who had she had sort of a rocky era during her 40s, and metformin was really a game changer for her, which again indicated the blood sugar component of it all. And now she's hesitant to start. I think it's tirzepatide, but her doctor had told her that we could actually use both. Is that something that you've seen, or and what does that
For
look like?
sure.
Yeah.
Yeah, in fact, I would always, if someone's already on a metformin, I would always layer the GLP-1 on that.
Mm,
And then like sometimes time will tell, like technically, physiologically, the GLP-1 probably trumps metformin a little bit. It's like more powerful. So it's like when, in the grand scheme of things, when we're dealing with like costs and pill burden and like it's like, do we really want to be on this? Sometimes the metformin, it's like, oh, let's see if we can do without that
yeah.
because
Yeah.
the GLP-1 will carry the load. But I need to think of a good analogy for this because this comes up quite frequently where it's like, oh, this didn't work, so I'm going to try this. That doesn't make sense if
Hmm.
it's like, hey, I need to have $100. So in order to get $100, I'm I'm gonna I'm always gonna add the 20 to the 20 I already have. I'm not gonna give you the 20. You know what I mean? It's
Yes.
like
Yeah. Yeah.
we're
Yeah.
gonna work towards that, and then it's like we're gonna ease off
Hmm.
of things.
Hmm.
When they complement each other like that.
The other question tied into that is you said during like the presentation part, you were talking about how, you mentioned like disordered eating, how you've seen it both help that, but then also
Yeah.
be contradictory to that. I've also seen that where when I have women in my circles that they start to see success with a GLP-1 and then all of a sudden they dose up and up and up and you're like, whoa, like where'd you go, sister?
Uh,
But my question for you is, are there any circumstances in which you have seen this not work for people? Like, would you say that it's like overwhelmingly 90+% of the time this is helping people with various issues, or are you saying that seeing that it's nuanced and there's people that are struggling with trying it?
okay, this gets into the thing about medicine that I am most fascinated with. Are we talking related to weight specifically most of the
I mean,
time?
sure, we can make it a
Yeah.
simple question that way. Yeah.
So, um, there is such a nervous system component to body image
Hmm.
that the only time I've seen a GLP-1 not work is when someone is unable slash unwilling, but you're only unwilling if you're unable to really delve into like the personal development that
Yeah.
it's required to take on a new identity of a healthier person. Because when we grow up wearing the identity of fill in the blank, for some women, it's the big girl. It's everybody in my family's big. It's, I don't want to be the one. This is how we eat in my family. I don't want to be the one bringing my own shit to the potluck because everything else is creamy and gluteny and whatever. Not that you have to do that all the time, but it's like the social conversation around weight is so influential. It's very analogous, honestly, to anyone, if any of our like entrepreneurs or like they talk about this in like building a business or like the personal development work that it takes to like go on that journey is so strong. So some people with a history of sexual abuse, um, you know, or physical abuse or, other types of childhood traumas, like that's much more of a sticking point. Sorry to get like deep, but then the like biochemistry is
Hmm.
actually downstream from that.
Yeah, that makes sense.
And like when you said, I forget how you said it, like glucose regulation being kind of the root, it it all nervous
Hmm.
system regulation trumps
Yep.
everything.
I mean, I've experienced that in my own journey, right? I mean, I've
Yeah.
been with the chronic migraine and sending me into nervous system dysregulation, which then has impacted everything else, right? Like blood, I mean, obviously cortisol, but then blood sugar and realizing that food, right? Like having a snack could help me regulate my nervous system and seeing those interchange, right? Having questions to you about like, I guess I'll try this medication for my migraine, but I'm not sure how I feel about it. And you being able to position that back to me as if you don't know how you're going to feel about it, it's not going to work because your mindset is not in the
Yeah.
right place, right? So it really is like when we talk about like mind body medicine, right? That makes sense that that would be your answer. Like, have you ever seen this not work for someone? Yes, for someone that's not in the right mindset, right? Like that's
Yeah.
basically
And
what you're
it's
getting at. And I
not
know that.
and the yeah, and the fascinating thing is like when I hear mindset, I think
Right.
conscious, our intellectual side takes over and it's totally
It's
subconscious.
so, yeah, subconscious for
Yeah.
sure. Yeah.
My my philosophy related to like what's your best next step truly comes down to like I picture a Venn diagram, the three circles. One of them is what does your body need? That's my jam, right? I got 100 ideas. Like I can tell you everything that your body needs, nutrition wise and fitness wise and medications. And, there's so many things that your body needs. But then another circle is what do you have the capacity to do, right? Maybe that's time capacity, financial capacity, nervous system capacity, like what can I actually accomplish, right? Because it doesn't make sense for me to like, and this was very foundational in setting up my coaching program. It's like, wait a minute, if the root of women's issues is that we're all walking around way too stressed, tired, overwhelmed, how am I going to give you like a 15-point project plan of tracking your macros and doing this? I'm just adding to your I'm just
Right.
adding to your dysfunction, right? So,
Yep.
okay, what does your body need? What do you have the capacity to do? And then the one on the probably should be on the top is what do you want to do?
Yeah.
You know? And so that what do you have the capacity to do and what do you want to do? Those two technically outweigh what your body needs, right? Like it has to we have to design that win-win in the middle. And
Yeah.
I think our, intellectual brains feel kind of is like, well, we don't value like, do I want to do this, right? We think, oh, I should just grind through it. But like nervous system wise, it's never going to work.
Yeah.
It's not even like you could get away with it for a while, but your nervous system will never let you infuse that into your habits. So that's why, to your point, oftentimes I oftentimes hear people say like, "Oh, I wish I didn't have to take this medicine." I'm like, "Oh, well, wait a minute. Like, we can't be like ingesting something every day. Like, begrudgingly or it's not going to
Hmm.
work. Like it
Yeah.
just doesn't, it's not
Yeah.
good for us, right? So, not that, it probably is aspirational for us to be super excited about taking a shot every week or something.
Yeah.
But, we do have to get to the point where it's like, you know what? I have hope that this will work.
Mhm.
I am willing to accept this into my physiology and see what happens.
Yeah. Well, you touched on
So,
something there that I think is a great place for us to wrap up, which is my new favorite meme, I guess, I should say, or my new favorite graphic on social media that I find myself saving over and over and over again, which is I think Brendan Burchard shared it first. It's this thing that says, who does she think she is? And then it says below that it says, clearly she's a person who really doesn't care who you think she is. And I think that that's like from what I'm learning, even at 42, and what I'm learning about menopause, tapping into, I love the M Factor documentaries, those things you were sharing, all those books that I've nerded out on, all the podcasts I've listened to is this really is a time in our lives as women that we get to sort of almost like, um, revert back in a way to our childhood self in a much more mature way. Like we're no longer, sort of like, I still have little ones. Hopefully my little one's out of the closet by now. If you were on the beginning of this webinar, she was having a tantrum in the closet. Hopefully we're past that. Hopefully my husband's handling it. But I'm still taking care of little ones. But as I, in the next decade, as I venture into menopause, I can sort of envision, I see this now, right? It's like, oh, I see why so many women are sort of like stepping into their power. You hear this
mhm.
like zero F's given, right? And then about like all of a sudden it's like we're just this is who I am, right? And this is what I
Yeah.
want. And so I love that you just said that because that's what it is. What do I really want? Like how do I want to feel? What's the energy that I want to bring? I think, up until I'll say our 40s, it's different for everybody, but we're taking care of everyone else and we're concerned about everyone else, right? Like our kids, even our parents, like a lot of us in that sort of sandwich generation caring for both. And I don't know about you guys, but even my husband today is always like, where's the charger? I'm like, why is no one mentally keeping track of these things but me? Right? Like women just carry the mental load of everything. And so as we go through this, as you said, physiologically stressful time, we're also sort of in that hippy dippy way, stepping into ourselves again. Right. And
Totally.
so it makes sense that we be like, as we've said, like we're educating ourselves along the way. We're advocating for ourselves along the way because we do deserve this energy. And it's really a matter of asking yourself, like, what do I want out of this? Right. And maybe a journey with GLP-1s or peptides is on your path, and maybe it's not. Having that conversation with the right practitioner is certainly going to be part of that equation. So
Yeah.
this is so good. I was actually thinking, like, as you were talking, I was thinking about all the awesome recordings we've done. And I'll just mention it here for you guys. If you're interested in learning more about, like, we did one on like bioidentical hormone replacement therapy. We went over myths versus facts. That's on my podcast. What I'll do is when we send out the recording, I'll send out a link of resources. It will have the ability to connect with Dr. Paige, both on social media as well as her coaching program. It'll have my education platform and program there as well, and then the telehealth options for you. So rather than put them in the chat as we hang up this call, I'll just know that that's coming via email. So if you have any questions about that, we will put that in there. But I started thinking, like, what are we going to be talking about? Like, I would have never thought 4 or 5 years ago we would be talking about peptides now. And so I'm excited. I already wrote down notes. I'm like, well, hopefully, maybe in the next few years, we'll be talking about genetics and the future of health and genetics. We'll be talking about
Mhm.
psychedelics. You think we'll talk about psychedelics? Like, there's so many fun
We are.
things that we,
I was
yeah.
going to say, the next phase. I was talking to someone today. Sorry, you're gonna have to edit this.
No, it's fine. We
You
can,
don't
yeah.
have to, you don't have to edit. I just think because I'm rambling, you were trying to
Yeah, no,
wrap
you're
it up.
fine.
I was talking to someone today and she was talking about a couple of things. And she said, like, well, I don't know if I want to do that because then I won't know was this helping or was that helping? And one of the things was fairly alternative. And she's like, and I don't know if I want to, like, that's maybe a little too woo. And I was like,
Mm.
I will tell you my two rising philosophies in all my training. One is I don't give a shit what's doing what if it's helping you. I am not going to take the time to tease out, oh, is it doing this or is it doing this? That is an intellectual pursuit that disrespects the complexity of the human body. As long as I can keep you safe on the flip side of like, hey, we're not going to start two things at once and then you have a reaction. We don't know what, you know what I mean? But
Yeah.
otherwise, get away from the, oh, is it this or is it this or is it no? All hands on deck. We're all towards healing. My second rising philosophy is the more woo, the better,
Same,
truthfully.
same girl, same.
So the next thing we'll probably talk about is microdosing. I will put it out there.
Yeah. Yeah. I love it. I would love to. I would love
Yeah.
to. Yeah. I mean, in the last 6 months, I've had people on the podcast about, we've talked all the way from ayahuasca to, mushroom, all the different things. So this
Oh,
is
good.
also intriguing, but I'm also from the camp of woo. In fact, I fired a pediatrician once that told me that everything I was telling her was woo woo science. And I realized it was, again, wrong, doctor. I need like my own little, is it a Giphy or Jiffy on social media? I need like one that's just like wrong, doctor, because I say it
Wrong
every time.
doctor.
But we have the right doctor tonight. So thank you, Dr. Paige, for coming on here, for doing this amazingly educational webinar for us. We're going to send out the recording for you guys in the next 24 hours. We'll have all the links that I mentioned for you. If you have any questions for us, you can follow us on Instagram or social media, just at Dr. Paige, at Jenny Swisher. But thank you guys for taking the time tonight. Until the next fun topic, we'll talk soon.
Yes. Yeah, kudos to you guys, honestly, for coming out because the other thing that I think is so, so powerful is and very clear is women heal in community. And
Mhm.
so, like, we need this time together, me just as much as you, um, in dedication to ourselves and to healing. I think that's kind of a forgotten art as well.
Amen to that. Amen to
So,
that. All right,
cheers.
ladies.
Good
Thank you guys
night.
so much. Have a good night. We'll take care.
Bye.